Well, we had a recent episode of the Mayor's Emergency Response Roundtable. Dr. Welsh joined Mayor West, and she was able to speak a bit more about trends and how in public health it's about so much more than just the numbers. It was a really valuable conversation, so we pulled a part of that for you here. Take a look.
And we cannot have a myopic view. Public health and epidemiology is about the story. It's about following the trend. It's about the narrative. And that means that we have to have the complete picture, and it has to be over time. So, for example, as this shows, and you look at this next slide, this is per 100,000, and if you do the next slide too, Heath, this is a weekly incidence rate per 100,000. So it's just like what we mentioned on the daily rate. You only have to be reporting the positives, and it's mathematically made every locality like 100,000 population. And I would think you don't have to be a mathematician, epidemiologist, public health. You can be any field, and you see that's a good downward trend.
There's so much good stuff in that episode. You can watch the entire thing. It's youtube.com/Chesapeake Television. And before we leave that one, I wanted to pull out this other clip from Mayor West. He had a great analogy to explain the percent positivity and what all goes into that, and
I'm so proud of
why how he can make sense out of it is really interesting. So calling all baseball fans, listen up. Mayor Rick West has got you with a COVID-19 explanation. Take a look.
I go back to my sporting days of you think about the at-bat. A baseball player is rated by his hitting percentage. So if you only counted the times you got a hit and didn't add the times you struck out, you would get a high batting average, all right? And so from a sports standpoint, you want to count the number of times that you actually struck out and got a hit in order to get a correct batting average. So